So we're out at Cooley Health. We're going to do another insight. Today we are going to talk about kind of your foot and ankle complex and working on the mobility there. We actually find a lot of problems with our student athletes that range outside muscular tightness in terms of their calf and their soleus complex and how that can actually restrict their range of motion. What we're really going to focus on today is what is actually could be happening, what the anatomy looks like, and then also just a couple ways to fix it. A lot of this stuff that we have on here we kind of borrowed from Mobility WOD, so I highly suggest checking that out for more videos on different things on how to fix this, and we're only going to cover a couple of things here. So a lot of times what happens is it's not always a soft tissue restriction when it comes to your ankle mobility. When we're looking at least 10 degrees, right? 10 degrees for dorsiflexion is about normal, 10 to 15, just double checking that I'm right there, which is being able to pull your toes up. There's a lot of ways you can work around that to trick yourself. We'll cover those in just a minute. But things that's happening with running, cutting, just generally being an athlete is you have bony anatomy obviously within your ankle that can cause a problem. So we're actually going to look at the skeleton. As you come down and you're looking at the ankle complex, you got your tibia, which is the big bone, fibula on the outside, and then sitting in that is your talus. So what can happen with this talus is it slides in and out. It's a drawer system. So when you're fully dorsiflexed, that is your most stable position of the ankle. That talus slides back, slides into that drawer, fits nice and tight. As you go and you plantar flex or put your toes down, that talus slides out, allows for that range of motion. Well, a lot of times when we have athletes that go and sprain their ankle and they get caught in that motion at the foot, kind of down and in, that talus can get caught stuck out further than it needs to be, and then as everything comes back, it may not be able to glide all the way back into its normal position, which can then cause a bony block of the ankle. So instead of being able to go all the way up, it may just stop short. So what we're going to talk about today on a couple of those things is how to fix that without necessarily having to go to someone like myself or Dr. Kyle and have us drive our thumbs or some other implement across that bone to help drive it back, which is not the most comfortable feeling thing ever. So one of the easiest ways to go and start moving this back is you got to make sure your calf is relaxed. But taking a simple 1 inch, could be a little bit more depending on your resistance, band and driving it across the front of your ankle. What that's going to do is it's going to allow that to help guide everything back as you're working through your motion in order to help relocate that bone. So we'll go out and we'll get plenty of tension on it. Now we're going to cover this just a little bit more in depth in a minute, but we always want to start working in a very neutral arch, as you can see I got here. As we're driving forward with our knee, that's where we want to keep that neutral arch. That band's going to help try and drive that talus back, help everything align, but also while you're driving your knee forward, getting that range of motion back into place. So we can work through easily doing it that way. Then if we go and we retest, which I'll show you how to here in just in a second, we can also working out to the side with some knee tracking, and if we need to, try and work onto the inside, still trying to maintain that arch. What we don't want is just to completely collapse because we're not going to get anything out of that motion. So when we look at trying to test that range of motion, or even if you're trying to stretch your soleus with your bent knee, we want to focus on making sure we're driving that knee over our second or third toe. We don't want to just get lax with it and let your knee go wherever it is, because it may look like you have a lot of range of motion when really you're lacking some. I can trick myself and drive all the way in with my arch collapsing, knee's gonna go into the inside of my toe, and I have all this great range of motion. Awesome, I'm fixed, right? Well, not necessarily, because if I go back and I try and run in that way, I'm gonna present myself a lot of problems. What we want to see is having everything lined up and then driving forward. I still got a decent amount of range of motion, but compared to the way before, it's a lot less. But I'm also setting myself up to be in the right anatomical position. So this is where we want to make sure that you're testing beforehand, and then after you go and you do that mobilization, testing afterwards. Restoring this range of motion can be huge if you're a runner, because it can take a lot of stress off your ankle and your foot and then all the way up the kinetic chain. If you're recovering from an ankle sprain, this is often something we look at very early to try and restore some range of motion that might not be there to help aid in our rehab. And really just for everyday aches and pains, having the ability to be able to pull your toes up is going to be hugely beneficial for you. We'll link up some other ideas, especially from Mobility WOD, in the description to this, but if you have some ankle problems, this is a great place to start.